This presentation introduces the proposed implementations of the Clinical Decision Support System (CDSS) within our organization. As a nurse informaticist, I have been tasked with the leading a multidisciplinary task force that will evaluate the guide of the adoption of a CDSS to improve the access to quality care and address disparities in health outcomes. This presentation will review the goal of the project, the selected CDSS tools, the stakeholders involved, the technology that supports the implementations, and the next step of the task force. The purpose of the today's meeting is to introduce the initiatives to implement the clinical decision support systems within our organization. The task force will evaluate how this technology can improve clinical decision making and reduce disparities in access to care. During this meeting, we will review the organizational needs for this project, discuss the selected CDSS platform, identify the roles of the task force members, explore how the system integrates with the existing technologies, and establish the next step necessary for the implementation. Healthcare organizations increasingly rely on the data-driven tools or to support clinical decision making. However, disparities in health outcomes continue to exist, particularly among underserved population. A CDSS can help address these issues by providing clinicians with evidence-based communications and at the point of care. This improves the consistency and treatment decision and help ensure that all patients receive high quality standardized care regardless of the provider or the location. Clinical decision support system assist providers by integrating evidence-based guidelines directly into clinical workflows. This means clinicians receive alert reminders and recommendations that support safe and effective patient care. So CDSS tools also help reduce the medical errors by identifying potential medication interactions or missed screening. Or nurse, as a nurse informaticist, I bring both the clinical knowledge and the technical expertise to this project. My role is to bring the gap between the clinical staff and implement information technology teams. Implementing the CDSS requires the collaboration among the multiple stakeholders. Physicians and nurse provide the insight into the clinical workflows. So each member of this task force contributes a unique expertise to ensure the successful CDSS implementation. So physicians evaluate the clinical accuracy of decision support recommendation. Nurses provide critical feedback on how the system integrates with the patient's care workflows. IT specialists are responsible for configuring the system and ensuring interoperability with the electronic health records. Quality improvement professionals monitor outcomes and evaluate how whether the system improves care delivery. Administrator helps align the project with the strategic organizational goal. For these initiatives, we propose implementing Epic's clinical decision support tool. Epic is one of the most widely used electronic health record system in the United States and includes the robust decision support capabilities. The system integrates patient data with evidence-based clinical guidelines to generate alert reminders and recommendation during the patient care. These tools can identify medication interaction, recommend the preventive screening, and guide treatment decision based on the patient specific information, improving overall care quality. Epic CDSS tools can help reduce the disparities by ensuring consistent adherence to clinical guidelines across all providers. The system can identify patients who may be at risk due to the social determinants of health, chronic disease, or lack of preventive care. So the most critical function of the CDSS include the real-time alert and reminder that helps clinicians follow the evidence-based practice. So one important communication technology that can benefit the CDSS integration is telehealth. During virtual visit, clinicians can use decision support tools to guide the assessment and the treatment decisions. So effective communication among the task force is a task force member is essential for successful project implementation. Microsoft Team will be used as the primary collaboration platform to meeting, discussion, and document sharing. Email communication will be used for formal updates and project announcements. Share folders will allow team members to access project documentation, research material, and the progress report. Regular virtual meeting will ensure the stakeholders remain informed and engaged throughout the implementation process. The next step involves reviewing the full capabilities of the selected CDSS and providing training materials for task force members. We will conduct a workflow analysis to understand how the system integrates with current clinical practice. So, following this, an implementation timeline will be developed. A pilot program will be conducted in selected clinical departments before expanding across the organization. During this phase, we will evaluate the outcomes of refine the system based on user feedback.